President of AIDS Healthcare Foundation. Michael Weinstein.
Greetings. As the co-founder and president of the AIDS Healthcare Foundation, the largest AIDS NGO in the world, I am proud to add $10 million in support to the mission of the Global Fund. AHF began in 1987 in Los Angeles as the AIDS Hospice Foundation to give a dignified death to patients, primarily gay men who were dying in the hallways of county hospitals. As life expectancy of AIDS patients improved in 1990, we became the AIDS Healthcare Foundation. With the advent of the HIV cocktail in '96, we expanded nationally in order to bring as many people as possible into the lifeboat of treatment. In 2000, before the Global Fund and PEPFAR, while attending the International AIDS Conference in Durban, South Africa, activists pleaded with me for help in bringing treatment to Africa. At that time, only 50,000 people in Africa were receiving medication. As a result, AHF's global program was born. We started with only 100 patients in South Africa and Uganda because the cost of drugs was $5,000 per patient per year. But we activists fought for and won access to generic drugs, resulting in the dramatic scale-up of treatment. 7,000 AHF staff now serve 1.6 million patients in 45 countries in Africa, Asia, Latin America, the Caribbean, Europe, and the United States. And we can only do it because of the drugs and other supplies paid for by the Global Fund. The Global Fund is unique among all global entities in recognizing the importance of NGOs and including us in their governance, and they are stronger because of it, and it is for that reason that we pledge today. The Global Fund, under the leadership of Peter Sands, has a stellar record of fairly and effectively distributing funding with input from all constituencies. The last 3 years has taught us that the world requires a new global public health convention based on transparency, accountability, and coordination. AHF believes that the Global Fund, based on its track record, is best positioned to make this happen. So we strongly urge all the donors and implementers to support the immediate expansion of the mandate of the Global Fund to encompass all infectious diseases. 6 million people have died of COVID, and trillions of dollars of wealth have been destroyed. And yet we must have sessions such as this to beg the world community for their support. But supporting global health is not charity. It is essential to our collective security. Thank you.
Thank you to Michael Weinstein. Yes.